Go.
Okay, good morning. My name is Heather Haynie, and I'm a nurse. And I wanted to talk with you about being providing culturally competent care to our population of patients. Now, I have I have selected Jehovah's Witness because the group is a growing population. Is a religious group, and they have been around for over 100 years. The Jehovah's Witness came to life in 1872 by Charles Taze Russell. He started this movement during the Adventist movement in Pittsburgh. The followers believe that the Bible is the true word of God, and everything that is written in the Bible, they follow it to the T. They're politically neutral, and they don't vote, they don't celebrate Christmas. Um, they started their blood ban in 1945, where they believe that blood transfusion is a violation of the sanctity of the body. Based on what I have interviewed with a Jehovah's Witness patient that said that anytime the blood leaves the body, it is no good. So basically, the blood ban, they have been following this since 1945. They will, from their medical standpoint, as far as medical treatment goes, they accept all form of medical treatment except for the blood transfusion that I talked about. They do not exercise the right to die. So basically, they're not going to say, well, okay, I just want to die, but they'll let the natural process takes its place. They will cooperate with medical professionals when it comes to their treatment and their care, and also the care for their children and their families. Their blood transfusion and blood products, they do not take whole blood, nor packed red blood cells, blood plasma, even autologous blood pre-donation, which means that if I'm going to have a surgery later on and I know I may need blood, they cannot use their own blood. They will not allow their blood to be drawn and stored, so they will not do that. They will accept any kind of cardio or any kind of bypass surgeries. They will have bloodless surgeries, which is what is becoming more popular now today. The bloodless surgeries is a new thing to help to accommodate this group. They will also do renal dialysis, and being in a dialysis clinic, we do have patients that are on dialysis, and their belief, interviewing one of the patients, they believe that the tubing and the fact that the blood runs through the tubing and through the filter and returns back to their body is not a violation, so they will accept dialysis. Clotting factors, they may accept that. They will also accept some fractional blood products, meaning that they may take blood platelets, but they will not take the other parts of it. They will take albumin, but they will not take the other portions of the blood because that is a violation. The ethical standpoints can be surmountable because, of course, when you have an emergency situation, when the doctor has to make a life and death decision, most of them will carry a card with them. And if they do not have that card and that doctor decides to do that, then they will accept that as long as later on they will find their card that they have. It's like a medical alert card that they will have, medical alert card that is, they will carry with them to let them know that they have this limitation. Advanced directives, that is one of the things that they will have to say that they don't take blood transfusions or anything like that. Children are given the best care possible, but the final decisions sometimes is not left up to the parents. The parents will say, I'm a Jehovah's Witness, but if the child's welfare is in total jeopardy, the doctor or the medical professional will make that decision. The anemia management portion, sometimes they will tolerate low iron until it becomes very problematic for them. But most of the time they will try to have things that will help build up their blood. Certain vitamins and things like that that will help build their blood, increase their blood iron stores and such like that. Pharmacological agents that they can use, they will take anything that's anti-fibrin to prevent the blood from clotting, especially. And completing these things kind of help to make them survive really traumatic situations. So basically, as a medical provider that we have to try to make sure that we understand these things about them and to ensure that they are given the best care possible. And this is only one sector of the population of the United States. We have so many other areas that we haven't even touched. This is only about the Jehovah's Witnesses. They are becoming such a large group. I mean, this is a worldwide religion. So basically, they will be the kind that we will encounter on our day-to-day practice.
Right.
So, with that said, are we able to give them the best care?
Yes, we are.
Yes, we are. And does anybody have any questions at this time?
No, I mean, I know that the blood ban is in place, but it seems as though if they're willing to accept the renal dialysis, and the blood is intubated when it's going through, that it's almost the same procedure as in blood transfusions, because the blood is intubated at that time. It's enclosed, so it's questionable, but to be culturally competent, you have to abide by the wishes of your patient. So.
Right, absolutely.
And I think this was very well presented, Heather. May I keep this outline for future
Sure.
reference?
Sure.
Because this makes me think a lot.
Thank you. Okay. Thank you so much for participating in my presentation, and I really appreciate it.
Thank you. This was great.